If you've been dealing with back pain, numbness, or weakness in your legs, you might have spinal stenosis. But don't worry, spinal stenosis is very common. And in this video, I'll break down what it is, how it affects your body, and the best treatments to help you manage and even eliminate the pain. So let's dive in. Hi, I'm Dr. Deeptee Jain, an orthopedic spine surgeon, and on this channel, I share valuable tips and insights to help you take care of your spine and live a pain-free life. If you're suffering from spinal stenosis or want to learn more about it, you're in the right place. Be sure to subscribe for more helpful spine health videos. Spinal stenosis is a condition where the spaces within your spine narrow, putting pressure on the nerves that run through it. This narrowing typically occurs in the lower back and the neck, but in this talk, we'll focus on the low back, and it can cause significant pain, numbness, and weakness. Think of your spine as a tunnel, and the nerves are the wires that are running through that tunnel. When that tunnel narrows, the wires get squeezed, and this leads to pain and discomfort. Spinal stenosis is more common as we age, but it can affect people of all ages. There are several different causes of spinal stenosis, but the most common, simply put, is arthritis. As our spines become arthritic as we get older, the discs degenerate and naturally lose their height, leading to collapse in the space that's available for the nerves. The facet joints in the back of the spine become more inflamed and develop bone spurs. The ligaments in between the bones get thickened, and all together they cause narrowing of the spinal canal. It's usually some amount of combination above. There are also other causes like infection and tumor, but these are less common. The symptoms of spinal stenosis can vary depending on where the narrowing occurs in your spine. The most common symptoms include pain. If there is stenosis in your low back, you might experience pain or cramping in your legs, especially with standing and walking. A hallmark symptom of spinal stenosis is that this pain improves when you either lean forward or when you sit down. Numbness or tingling. This is common in the extremities depending on exactly where the nerve root compression is happening. Weakness. You might notice weakness in your arms or legs, which can make it difficult to stand or walk for long periods. And as I mentioned, pain that improves with sitting. A unique symptom of spinal stenosis is that the pain often improves when you sit down or lean forward. For example, on a shopping cart, as this helps actually relieve the pressure on the nerves. If you think you might have spinal stenosis, the first step is to visit your doctor. The doctor will likely perform a physical exam, checking for symptoms like weakness or numbness. To confirm the diagnosis, your doctor may recommend imaging tests like the following. X-rays. X-rays are very important for the surgeon to gain an overall understanding of the structure and the alignment of your spine, and also to see if there is any abnormal motion. These are findings that cannot always be visualized on a more advanced imaging study like an MRI. Next, an MRI. The MRI gives a three-dimensional understanding of the spinal canal, and it helps us better visualize the soft tissues and specifically the nerves in the spine so that we can see with our own eyeballs if the nerves are actually pinched. Sometimes patients can't get an MRI for a variety of reasons, and in that case, we might order another test called a CT scan. Treatment for spinal stenosis really depends for the most part on the severity of the symptoms, and importantly, treatment is guided by you. There is no wrong and there is no right, and here are some of the common options. Physical therapy. A physical therapist can teach you exercises to strengthen the muscles around your spine, which can help alleviate pressure and improve mobility. Medications. Over-the-counter pain relievers like ibuprofen can help manage inflammation and pain. In some cases, prescription medications like nerve pain medications, muscle relaxers, and anti-inflammatories can also help with the pain. Next, injections. There are a multitude of different kinds of injections. One very specific kind is an epidural steroid injection. These injections go directly around the spinal nerve roots and help reduce inflammation around the nerves to hopefully obtain relief. Sometimes the relief is temporary, sometimes it's more lasting. Lifestyle changes. For example, we know that losing weight can improve symptoms because weight loss results in decreased pressure on the nerves. Finally, surgery. In persistent cases, you might want to consider surgery to relieve the pressure on your nerves. The exact type of spine surgery really depends on your very specific spine. It might involve a decompression alone, which involves taking the pressure off the nerves. It might involve a decompression with a fusion, which involves fusing multiple spine bones together. So have you experienced these symptoms and tried any of these treatments? Let me know in the comments what worked best for you, or if you have any questions about specific treatments. While most people with spinal stenosis can manage their symptoms with non-surgical treatments, surgery may be a good option if your symptoms are really severe. This condition can be really disabling, mainly because people have difficulty simply walking distances. If the pain is severe and doesn't improve with physical therapy, injections, medications, surgery may be a good option. So to recap, spinal stenosis occurs when the space in the spine narrows, putting pressure on the nerves. Symptoms include pain, numbness, and weakness, and it's typically diagnosed with a history and physical exam from your doctor, as well as imaging tests. Treatments range from physical therapy and medications to surgery. If you found this video helpful, don't forget to like, share, and subscribe for more tips on spine health. And if you have any questions or experience to share, leave them in the comments below. I'd love to hear from you.